carcinoma in situ or intraepithelial carcinoma. So carcinoma in situ is also known as intraepithelial carcinoma. So it is a condition which arises frequently on the skin, but also it occurs on the mucous membrane of the oral cavity. So some authorities believe that this disease is a precancerous dyskeratotic process. Some others says it is a intraepithelial type of superficial epithelioma or carcinoma. So precancerous dyskeratotic process or intraepithelial type of superficial epithelioma or carcinoma. Chandler Smith, he expressed in discussion on the concept of term carcinoma in situ. He explained something about carcinoma in situ. Chandler Smith. So it does not reveal whether the lesion is a cancer, not now, but has not yet become invasive, or whether it is not a cancer now, but will become a cancer at some later time. So he says that it is not a lesion that producing cancer, but also it may produce cancer at some later time. So he explained the condition carcinoma in situ. Chandler Smith. So in this stage it does not exhibit invasive malignant properties. So in this stage it has not invasive malignant properties, and the metastasis cannot occur without infiltration of tumor cells into the connective tissue and consequent accessibility to lymphatic or blood vessels. So metastasis is impossible in intraepithelial carcinoma or carcinoma in situ. So Bowen's disease, it is a special form of carcinoma in situ or intraepithelial carcinoma and occurring with some frequency on the skin, particularly in patients who have had arsenic therapy. Next, moving on to the clinical features. It is most occur in floor of the mouth, tongue, lips in males, and it is more common in the men. The men-woman ratio is 1.8:1. So it is more common in the men, and it is occur in elderly persons. So this is carcinoma in situ, and it has occur in the floor of the mouth and lips in males and tongue. Next, moving on to the histological features. It is very important. So the intraepithelial carcinoma is characterized by a remarkable range of variation in histological appearance. Keratin may or may not be found on the surface of the lesion, but if the keratin is present, more apt to be parakeratin rather than the orthokeratin. So if the keratin is present, it is the parakeratin type, and the individual cell keratinization and epithelial or keratin pearl formation are exceedingly rare. So these appear to be the hallmark transformation. If there is a presence of keratin pearl formation or the individual cell keratinization, it is the hallmark of the transformation of carcinoma in situ into invasive carcinoma. So if it is present, we have to test for biopsy, it is a malignant condition or not. And certain cytological alterations may also occur, and there is an increased nuclear or cytoplasmic ratio and nuclear hyperchromatism are seen. And cellular pleomorphism, it is uncommon, and one of the most conspicuous and consistent alteration is loss of orientation of cells and loss of their normal polarity. So there is a loss of orientation of cells and loss of their normal polarity. So mitotic activity is extremely variable, and a sharp line of deviation between the normal and altered epithelium extend from the surface down to connective tissue, and all the above changes occur within the surface epithelium, which remains the basement membrane, confined by the basement membrane. So this picture showing the C. In situ cancer, there is a cell stays in one place. There is no invasive or into the connective tissue or into the bloodstream. If it affect, then it produces the malignant tumor. So it is the intermediate stage. And a treatment, there is no special treatment or no uniformly accepted treatment for intraepithelial carcinoma. The lesions have been surgically excised, irradiated, cauterized, and even exposed to solid carbon dioxide. And there is spontaneous regression of carcinoma in situ without treatment is known occur certain sites. Example, uterine cervix. Without treatment, there is a spontaneous regression is also occur. So there is no special treatment for this carcinoma situ.